Hello and welcome to the RMS 205 Medical Surgical Nursing exams. This examination was covering introduction to medical surgical nursing, respiratory condition, cardiovascular, and hematological system disorders. Right? So let's get right into it. The first question was a patient suffering from sinusitis affecting the ethmoid bone will feel pain in. All right, this question was looking at the upper respiratory tract disorders, also the sinusitis, right? And looking at the options, if somebody's the ethmoid bone is affected, they are going to feel pain between and behind the eyes. Remember, the ethmoid sinuses are located between the eyes and near the nasal bridge. If you're talking of the forehead, this one is more of the frontal, while the maxilla is below the eyes, right? Number two, the first structures in the lower respiratory tract capable of gaseous exchange is looking at this option C is the best one, respiratory bronchioles, because these ones they normally have alveoli budding from their walls, and this normally enables gas exchange. Early manifestations of shock in respiratory systems include early manifestation of shock in respiratory. Okay, this will be more of compensation mechanism. So we're going to be hyperventilating, right? Hyperventilating. And when you're hyperventilating, you're going to reduce the amount of carbon dioxide. So there will be reduced carbon dioxide partial pressure, while oxygen might remain normal. The most common cause of bacterial pneumonia is, right, most infections are caused by Streptococcus pneumonia. Right, it normally leads to lobar pneumonia and can present with symptoms such as fever, productive cough with rusty sputum, and chest pain. In adult respiratory distress syndrome, compensatory hyperventilation may lead in hyperventilating. You reduce the amount of carbon dioxide, so hypocapnia, right? And hypocapnia, when you've lost CO2, it means you've lost more acid, so it becomes more alkaline. Respiratory alkalosis. Option D. A nurse is working in the rural county's public health department has been alerted that there is an outbreak of tuberculosis in the area, which clan is at the highest risk of TB. All right, the homeless man with the history of alcoholism is the one that is at increased risk. One of the following symptoms will suggest a tension pneumothorax. Tension pneumothorax will always have deviation of the trachea. Remember, air enters the pleural space and cannot escape, and this leads to increased pressure within the chest. This pressure can cause a shift of the mediastinum and tracheal deviation to the opposite side, which is a classic sign of tension pneumothorax. The patient teaches a patient the nurse teaches a patient with intermittent allergic rhinitis that the most effective way to decrease allergic symptoms is correct to identify and avoid triggers for allergic reactions. Assessment findings that will indicate pulmonary embolism, right? Pulmonary embolism is an emergency, so that's why you're looking at option D, tachypnea, chest pain, and anxiety. Pulmonary function tests are diagnostic procedures commonly done for a patient with COPD. One of the following is an indication. Indication is if you want to monitor the patient's response to therapy, you do the pulmonary function tests. They are many commonly used to evaluate how well the lungs are functioning in patients with COPD, such as the asthma, the chronic obstructive pulmonary disease, the pulmonary fibrosis. And one of the key indications for pulmonary function test is to assess the patient's response to therapy, which keeps in adjusting treatments or medications accordingly. Pulmonary function tests can also measure things like lung volumes, airflow, and gas exchange capabilities. The first intervention for a client experiencing myocardial infarction is first myocardial infarction, you administer oxygen. Remember, you normally use the MONA protocol. That is morphine, oxygen, nitroglycerin, and aspirin. But the actual order of intervention prioritizes oxygen to stabilize the patient. So you administer the oxygen to ensure there's enough tissue oxygenation and reduce hypoxia. Then administer sublingual nitroglycerin, where you reduce the myocardial demand by dilating coronary arteries. Administer aspirin. This will help prevent clot formation. Lastly, morphine, which relieves pain and reduces myocardial workload by lowering the preload and the afterload. The following symptom is the most commonly associated with left-sided, right? When the left ventricle fails to pump blood effectively to the body, this normally causes blood to back up in the pulmonary congestion, and this backup increases pulmonary capillary pressure, leading to pulmonary congestions and fluid accumulation in alveoli, and that's why there's a manifestation of Cracker's on auscultation. Septal involvement occurs in which type of cardiomyopathy? Septal is associated with hypertrophic, which is normally characterized by thickening of the heart muscles, particularly in the interventricular septum. Which type of heart failure does the patient have? Current prior symptoms of heart failure associated with underlying structural disease. Underlying structural disease, like patients with fatigue, dyspnea, reduce, are likely to be at stage C. The primary purpose of chilling tests is to measure the client's ability to absorb vitamin B, because this one is what is normally used to diagnose pernicious anemia, a condition that is caused by impaired absorption of vitamin B12 due to the lack of intrinsic factor in the stomach. The drug of choice for managing sickle cell anemia is hydroxyurea, because this drug works by increasing the production of fetal hemoglobin, which reduces the sickling of the RBCs, decreases vaso-occlusive crisis, and improves oxygen delivery. The best source of active bone marrow from a 24-year-old patient is the iliac crest, right? It is easily accessible and provides a sufficient quantity of bone marrow. The following blood group is referred to as the universal recipient. The universal recipient is AB, and this is because they can receive blood from any group. Could it be A, B, AB, or O? And this is due to the absence of antibodies A and B antibodies in their plasma, which prevents the destruction of donor RBCs. Another following is a high risk of infective endocarditis. The presence of prosthetic cardiac valves. These artificial surfaces are more susceptible to bacterial colonization. One of the following tests is done to confirm diagnosis of rheumatic fever, right? Rheumatic fever. Looking at number one, alpha 1 antitrypsin. This test is normally used for alpha 1 antitrypsin deficiency, which majorly affects the lungs and the liver. Rheumatoid factor. This is normally used to diagnose rheumatoid arthritis. Creatinine kinase. This measures muscle damage, commonly used in myocardial infarction or in muscle disorders like the rhabdomyolysis. So the correct answer is anti-streptomycin O. So rheumatic fever is a complication of group A streptococcus infections, e.g. the strep throat or scarlet fever. Anti-streptolysin, that is abbreviated as ASO, caps, is an antibody produced against this streptolysin or toxin and is released by Streptococcus pyogen. So elevated antistreptolysin titers confirm the recent streptococcal infection, which supports the diagnosis of rheumatic fever. For priority nursing intervention for a client with COPD, you need to administer oxygen therapy, you encourage effective airway clearance, promote adequate breathing patterns, administer prescribed medications, encourage smoke cessation and lifestyle modification. For diagnostic findings that guides you to confirm the diagnosis of TB, you could do a positive sputum smear or culture for Mycobacterium tuberculosis. You could do chest X-ray. You could do the Mantoux test, the gene expert. You can use the clinical features and the histopathological examination. Pathophysiology of asthma. Talk about the triggering exposure, activation of the immune cells, inflammatory mediated release, bronchoconstriction, increase mucus secretion. Then you have airway edema, airway remodeling, hyperresponsiveness of the airway, resultant airflow observation, and lastly gas exchange impairment. Three causes of secondary hypertension. Secondary hypertension can be caused by renal diseases, endocrine disorders, obstructive sleep apnea, and use of some medication, coarctation of the aorta. Pathophysiology of mitral stenosis. Talk about narrowing of the mitral valve, increased left arterial pressure, and you have pulmonary congestions and hypertensions, right heart strain, lastly decreased cardiac output. For nursing intervention for a patient diagnosed with sickle cell, you have to administer oxygen therapy, promote hydration, manage pain effectively, and monitor for signs of infections, encourage rest and activity balance, administer food, blood transfusion if ordered, encourage the patient and family to teach about the triggers of sickling crisis, and monitor for the complications. 5. Manifestation of acute myelolytic leukemia. This is a position from the hematological conditions. So there's fatigue and weakness, frequent infections, bleeding tendencies, bone pain, fever, pallor, splenomegaly or hepatomegaly, and unexplained weight loss. So formulate a nursing care for a patient with congestive cardiac failure based on fluid volume excess, defective breathing pattern, decreased cardiac output, and deficient knowledge. So we have on the fluid volume excess, the assessment, nurse interventions, the outcome goal, effective breathing pattern, the same. Then go to decreased cardiac output, deficient knowledge. Patient B, you are supposed to describe pathophysiology of pneumonia, criteria used to grade, and immediate management of patient diagnosed with community-acquired pneumonia. So in pathophysiology, we have pathogen invasion, followed by inflammatory response, exudation, impaired oxygenation, and then resolution of progression. For the criteria, we have the CAB 65, look at confusion, any evidence of new disorientation, urea, is it more than 7 milliosmoles per liter, the respiratory rate equal to or greater than 30 breaths per minute, is the blood pressure less than 90 systolic or less than or equal to 60, is the age 65, right? So that you classify them into 0 to 1 low score, 2 moderate score, 3 high score, right? Immediate management, you provide oxygen, empirical antibiotics, fluid monitor management, monitor vital signs, sputum collection, fever and pain management, bronchodilators if used, positioning, educating, and consider hospitalization if the patient meets the COOPS criteria for severe to moderate community-acquired pneumonia. Okay, guys, that marks the end of our presentation on RMS 205.